Did you know that diabetes can manifest in ways that many people overlook? Skin problems such as wounds that don't heal, incessant itching, and frequent infections are just a few signs that your blood sugar levels may be out of control. Believe it or not, these manifestations are more common than you might think and can significantly impact people's lives. For example, dry, scaly skin isn't just uncomfortable. It can be a warning sign of more severe complications. And those wounds that seem to never heal. They can turn simple activities into painful challenges. But don't worry, there are effective ways to manage these symptoms and improve your quality of life. From identifying early signs to adopting daily skincare practices, we'll explore everything you need to know. You'll discover how small changes can make a big difference, preventing complications like Claw-toe syndrome and diabetic ulcers. Let's embark on this journey of knowledge together, where each tip and recommendation is based on scientific studies and real-life experiences, providing practical solutions for your daily life. But before we continue, I want to say something important. For those of you who are truly seeking ways to stay healthy, I recommend subscribing to the channel and turning on all notifications to receive our content firsthand. I also recommend that you watch this video until the end. And for those dedicated enough to do so, I have a special gift. Diabetes doesn't just affect blood sugar control. It can also leave visible marks on your skin. Many people are unaware that skin symptoms can be one of the first signs of this condition. Imagine noticing persistently dry and scaly skin or those persistent itches that never seem to end. This could indicate something beyond a simple irritation. Studies show that about 1/3 of people with diabetes will experience skin problems at some point. Therefore, understanding this relationship is essential for early diagnosis and effective treatment. These skin problems can range from frequent infections to changes in skin pigmentation, rashes, and even severe diabetic ulcers. For example, someone dealing with wounds that take a long time to heal might be facing a direct complication of diabetes due to poor circulation and dehydration. Hence, it's crucial to pay attention to the signals your body gives. So, when you notice symptoms like these, seeking a healthcare professional should be a priority because the earlier it is diagnosed, the better the chances of controlling the condition and avoiding severe complications. The impact of diabetes on the skin is not just physical, but also emotional. Next, we'll explore how these changes can influence a person's social life and self-esteem, along with strategies to cope with these challenges. Skin changes caused by diabetes can have a devastating effect on a person's self-esteem and social life. Imagine the frustration of constantly dealing with dry, scaly skin and wounds that take forever to heal. It's not just the physical pain that bothers, but also the embarrassment of showing these affected areas in public. Studies indicate that people with diabetes-related skin problems can suffer from anxiety and depression, partly due to the perception that their condition is visible and stigmatizing. Moreover, the psychosocial impact extends to social and professional life. Frequent infections and persistent itching can interfere with daily tasks, affecting productivity at work and social interactions. It's as if every social encounter becomes a mountain to climb, with the constant fear of judgment and curious glances. Therefore, in addition to medical treatment, seeking psychological support and support groups to help deal with these issues is crucial. Self-esteem and mental health are just as important as the physical control of the disease. Early identification of signs of diabetes on the skin can be a real game changer in the treatment of the disease. Dark spots, relentless itching, and wounds that take a long time to heal are more than just nuisances. They are alerts that the body sends to indicate that something is wrong. Studies show that detecting diabetes early can prevent serious complications, significantly improving the patient's quality of life. Therefore, paying attention to skin health is fundamental for an early and efficient diagnosis. Additionally, doctors use these skin signs as valuable tools to identify diabetes before it causes irreversible damage to the body. A thorough skin examination can reveal conditions such as claw-toe syndrome or diabetic ulcers, which are indicative of more serious problems. So, when you notice any skin changes, it's essential to seek a healthcare professional. A simple consultation can result in an early diagnosis, allowing immediate treatment and preventive measures to avoid complications. Dry, scaly skin is one of the first signs that may indicate the presence of diabetes. It's common to feel a sensation of discomfort, as if the skin is constantly stretched and sensitive. This problem occurs due to dehydration caused by high blood sugar concentration, which interferes with the body's ability to retain moisture. For many, applying specific moisturizers for dry skin, rich in urea and ammonium lactate, can help alleviate the symptoms. However, it's essential that any significant change in skin texture be evaluated by a healthcare professional. In addition to dehydration, dry, scaly skin can lead to other complications such as cracks and infections. This is because the skin's natural barrier is compromised, allowing bacteria and fungi to enter. Keeping the skin well hydrated is crucial, but it's also important to monitor other conditions that may arise, such as itching or wounds that don't heal. Doing so can prevent major problems and help control diabetes. And always remember, drinking plenty of water and maintaining a balanced diet are simple measures that can have a big impact on skin health. Wounds that take a long time to heal are a classic and concerning sign of diabetes. This happens because high blood glucose levels can impair circulation, reducing the body's ability to repair skin damage. Imagine the frustration of having a small cut that persists for weeks or even months without showing signs of improvement. These wounds, often found on the feet, can develop into ulcers, increasing the risk of severe infections. Therefore, it's crucial to pay attention to any injury that seems to take longer than usual to heal and seek medical help immediately. To care for these wounds, in addition to medical follow-up, some practical measures can be adopted. Keeping the area clean and protected is essential, as is avoiding pressure or friction on the affected region. Using appropriate dressings and following a healthcare professional's instructions can speed up the healing process. Remember, prevention is the best approach. Regularly monitoring your feet and other areas prone to injury, especially if you have diabetes, can help identify problems before they become serious. All this reinforces the importance of constant and detailed skin care. Persistent itching is another common symptom that may be associated with diabetes. This discomfort, often underestimated, can indicate circulatory problems and skin dehydration. Imagine trying to concentrate on a daily task while dealing with incessant itching that won't leave you alone. The sensation can be more intense at night, interfering with sleep and affecting quality of life. It's important not to ignore this itching, as it can be a sign that diabetes is uncontrolled and needs medical attention. In addition to regularly moisturizing the skin, it is advisable to use products specifically for sensitive or dry skin, which can alleviate the itching. Avoiding very hot and prolonged baths is also an effective measure, as hot water can further dry out the skin. Consulting a dermatologist can help find suitable topical treatments and identify if the itching is related to other conditions, such as fungal infections. Attention to detail and constant skin care are essential for people with diabetes, preventing complications and improving quality of life. People with diabetes are more susceptible to frequent infections, and the skin is one of the main targets. This happens because high blood sugar creates an environment conducive to the growth of bacteria and fungi. Additionally, poor circulation hinders the body's response to infections. It's common to see cases of fungal infections, such as candidiasis, or bacterial infections, such as folliculitis, which can be quite uncomfortable and persistent. Therefore, keeping the skin clean and dry is essential to prevent these conditions. Adopting preventive measures can make all the difference. For example, wearing lightweight clothing and avoiding synthetic fabrics helps the skin breathe and avoid excessive moisture. Frequently washing hands and treating cuts and scratches immediately are habits that reduce the risk of infections. Seeking medical attention at the first sign of infection is crucial for obtaining appropriate treatment and avoiding complications. This constant care not only improves skin health, but is also an essential step in managing diabetes. Hives, characterized by red spots and intense itching, can be a complication for people with diabetes. These outbreaks can be triggered by allergies, stress, or even sudden changes in blood sugar levels. Imagine the frustration of dealing with incessant itching and visible lesions that can appear suddenly. For many, hives can be an intermittent but extremely uncomfortable symptom that directly impacts quality of life. It is crucial to identify triggers and seek medical guidance to control outbreaks. To relieve hives, in addition to medications prescribed by the doctor, some daily practices can help. Avoiding foods that trigger allergies, keeping the skin hydrated, and wearing cotton clothes can minimize symptoms. Oatmeal baths and cold compresses can also provide temporary relief. The key is to maintain strict control of blood glucose levels and be alert to any allergic reaction so that hives do not become a recurring and debilitating problem. Acne is not just a teenage problem. For people with diabetes, it can be a warning sign. High blood glucose levels can cause an increase in sebum production, leading to the appearance of pimples and blackheads. Imagine facing constant skin eruptions that seem resistant to all common treatments. This problem can affect self-esteem and cause discomfort, especially when lesions are inflamed and painful. It is important to understand that acne in people with diabetes may require a different and more intensive treatment approach. To effectively treat acne, in addition to dermatologist recommendations, maintaining a skincare routine is essential. Using products specifically for oily and acne-prone skin, avoiding excessive use of makeup, and washing the face twice a day with an appropriate soap can help control symptoms. Additionally, monitoring your diet and avoiding foods with a high glycemic index can make a big difference. The combination of topical care and strict blood glucose control can significantly improve skin condition. Changes in skin pigmentation are a common and often worrying sign for people living with diabetes. These changes can manifest as dark spots, known as acanthosis nigricans, which usually appear in skin folds such as the neck, armpits, and groin. Imagine looking in the mirror and seeing these spots that, in addition to being aesthetically unpleasant, can indicate insulin resistance. These changes not only affect appearance, but also serve as a warning sign for underlying metabolic problems. To deal with these changes, regular medical follow-up is essential. Dermatologists can prescribe lightening creams and topical treatments to reduce pigmentation, but diabetes control is fundamental. Keeping blood glucose levels under control through a balanced diet, regular exercise, and appropriate medication can prevent the progression of these spots. Additionally, applying sunscreen to affected areas can help prevent the dark spots from worsening. Prevention and appropriate treatment are vital to maintaining healthy skin and avoiding complications. Extremity atrophy is a serious and visible complication of diabetes, manifesting as a loss of muscle mass and volume in the hands and feet. Imagine having difficulty performing simple tasks, such as holding a pen or walking, due to muscle weakness. This condition results from poor circulation and diabetic neuropathy, where damaged nerves impair the proper nourishment of tissues. Unfortunately, this loss of muscle mass can be progressive and significantly impact quality of life. To address atrophy, physical therapy can be a powerful ally. Specific exercises to strengthen extremity muscles under professional guidance can help slow the progression of atrophy. Additionally, maintaining strict blood sugar control is crucial to prevent the progression of neuropathy. Adopting a diet rich in nutrients that support muscle health, such as proteins and vitamins, is also essential. Thus, with appropriate treatment and a healthy lifestyle, it is possible to improve muscle strength and maintain extremity functionality. Claw toe syndrome is a lesser known but quite disabling complication of diabetes. In this condition, the toes become permanently bent, resembling claws due to nerve damage and poor circulation. Imagine the difficulty of putting on shoes or even walking comfortably. This deformity not only causes pain and discomfort, but also increases the risk of foot ulcers, which can lead to more severe complications. Identifying and treating claw toe syndrome early is essential to avoid these consequences. To manage this condition, regular medical follow-up is important. Orthopedists may recommend the use of special orthoses to keep the toes in the correct position and prevent the progression of the deformity. Physical therapy with specific exercises to stretch and strengthen foot muscles can also be beneficial. Additionally, maintaining good blood glucose control is crucial to prevent the worsening of the neuropathy that causes claw toe syndrome. With these measures, it is possible to minimize the impact of this complication and improve quality of life. Diabetic ulcers are one of the most serious and visible complications of diabetes. These open wounds, often located on the feet, arise due to a combination of poor circulation, neuropathy, and frequent infections. Imagine living with a wound that doesn't heal, bringing constant pain and the risk of severe infections. These ulcers can progress rapidly, becoming deep and difficult to treat. For many, the simple task of walking can turn into a painful and debilitating challenge. Treating diabetic ulcers requires a multifaceted approach. Keeping the wound clean and protected is essential, as is following a strict blood sugar control regime. The use of special dressings that promote healing and prevent infections is common, and in more severe cases, antibiotics or even surgery may be necessary. Prevention, however, is always the best approach. Regularly inspecting the feet, wearing appropriate footwear, and seeking medical attention at the first sign of injury can prevent the development of ulcers. With these measures, it is possible to control this complication and improve quality of life. Now that you know the signs and complications that diabetes can cause on the skin, it's time to act. Maintaining strict blood sugar control is essential, but it doesn't stop there. Adopting a skincare routine, paying attention to early signs, and seeking immediate treatment for any changes can make all the difference. Imagine the freedom of living without constant worry about infections, wounds, or relentless itching. What are you waiting for to start taking better care of your skin and health? What changes can you implement today to improve your quality of life? Be proactive. Schedule that doctor's appointment you've been putting off, invest in specific skincare products, and most importantly, monitor your blood glucose levels carefully. Every step you take is a step towards a healthier and fuller life. So how about starting right now? Congratulations on making it this far. I'd like to ask for your like to encourage us to keep creating high-value content. Our mission is to reach and raise awareness among as many people as possible about the importance of healthy lifestyle habits, and we'd love to have your support. I also suggest you subscribe to the channel and turn on all notifications so you know when we post new videos. And as promised, I'm giving you a great gift for making it this far. Click the link pinned in the first comment of this video and discover a great surprise we prepared for those who want to live a healthy life. Or if you don't want our gift, I suggest you watch one of the videos appearing on the screen now. Let's stay healthy.